Thank you, everybody. This is the Asia Impact webinar on wellness in warring times. I'm Dongyan Park of the ERC, Economics and Research Department in ADB. And let me begin today's webinar by making a short presentation of the Asian Development Outlook Update 2020 theme chapter, which is also titled Wellness in Worrying Times. Next slide, please. So let me begin by briefly defining the term wellness because it's not well understood. So wellness refers to the active pursuit of activities, choices, and lifestyle that lead to a state of holistic wealth. And notice that wellness is different, conceptually different and distinct from happiness and health, because happiness and health refers to a subjective condition, being happy or being healthy. Wellness, on the other hand, refers to the deliberate or conscious pursuit of various activities and choices and lifestyle that lead to happiness or good health, physical health. And also importantly, notice that wellness is part of the UN Sustainable Development Goals, in particular SDG number 3. And it goes without saying that this COVID-19 crisis has highlighted the importance of wellness, because both physical and mental health has taken a battering during this COVID-19 crisis. Next slide, please. As you can see from this diagram or this chart, this shows the share of distressed individuals in diverse countries, China, UK, and the US, before and after the outbreak of COVID-19. There's a significant increase in each and every of those three countries, right, in the share of distressed individuals. And COVID-19, as I said earlier, truly highlights the importance of both physical and mental wellness. In terms of physical health and the COVID-19, it is a well-known fact that in addition to age, the elderly in particular, especially vulnerable to COVID-19, people with pre-existing conditions, whether it's diabetes or obesity or asthma or any other pre-existing physical precondition, they're more vulnerable to COVID-19. So it really highlights the importance of keeping physically fit. And at the same time, this lockdowns and social restrictions and being isolated from others, being cut off from others, this really adds a lot of stress and anxiety to people around the world. And in fact, a May 2020 United Nations report warned of a mental health crisis due to COVID-19. So the bottom line is that this COVID-19 crisis really strengthens the case for individuals and societies to take action to strengthen physical health and mental health. In other words, to pursue wellness, to take conscious, deliberate actions, choices, lifestyles to improve physical health and mental health. Next slide, please. In terms of its economic impact, we have to note that the wellness economy is already a large and growing part of the Asian economy. According to an ADB analysis, the wellness economy accounts for about 11% of developing Asia's GDP in 2017. And not only is it large, it's also growing rapidly at about 10% per year in recent years. The demand for wellness in Asia was growing rapidly well before the advent of COVID-19. In cities around Asia, including here in Manila, there's a lot of fitness centers, a lot of other wellness wellness activities, wellness industry activities, spas. You can see this in all major Asian cities. And furthermore, COVID-19, by highlighting, as I said, the importance of physical and mental wellness, will give a further boost to the growth of the wellness economy in the coming years. Next slide, please. I think it's also important to note that physical activities, some of which is optional and intentional or conscious, deliberate, and some of which is necessary and spontaneous, what we call natural movement. For example, farmers working their farms. Both these physical activity, in particular recreational physical activity, is supported by both private spending, out-of-pocket spending, as well as public spending. In terms of private spending, Asia has one of the largest and most diverse physical activity markets in the world, amounting to around $240 billion in 2018. But physical activity is not only for the middle and upper classes, it's for everybody, because there's a lot of ways in which governments and public spending can promote physical activity. For example, public infrastructure such as public parks and basketball courts in low-income neighborhoods, all of these promote physical activity. Next slide, please. The good news here is that Asia really has a wellness of a wealth, an abundance, a plethora of wellness traditions it can draw upon when it comes to mental and physical wellness. Well, as a matter of fact, when you hear the word wellness, right, many people associate it with rich Hollywood stars doing some exotic yoga sessions with some high-priced gurus, high-priced, expensive gurus, right? But that's really not the case at all. Wellness is really for everybody. And wellness, you could say it's rooted in Asia, as a matter of fact. So wellness, it's important to bring back wellness home, especially in these uncertain, stressful COVID times. More specifically, Asia has two rich wellness traditions to draw upon. One is a traditional Chinese medicine. The other is India's Ayurveda. So the wellness traditions of East and Southeast Asian countries are heavily influenced by these two traditions. I think it's important to note that there's a large and growing body of scientific evidence that loudly, clearly confirms the benefits of Asia's wellness traditions. In other words, the traditional Chinese medicine and India's Ayurveda tradition, these actually are very good for your health, good for well-being, and they really have a significant positive impact. Science is proving that. Next slide, please. So what can governments do to further promote wellness in Asia for all Asians, including poor Asians? Well, there are four cross-cutting policy domains. One is governments can contribute to a healthy built environment. For example, by making cities more walkable. Too many Asian cities, they're car-friendly, but not pedestrian-friendly. We can change that. Asian governments need to invest more to change that so it's more pedestrian-friendly, more walkable. Public infrastructure, as I said earlier, sports centers or sports facilities, basketball courts, football courts in low-income neighborhoods, and public parks where people can do Tai Chi and yoga and other wellness activities at no cost. And nutrition and healthy eating, for example, governments can impose, and many governments are already imposing taxes on sugary drinks and other unhealthy food, and also provide consumers with more information about what is healthy food, what is unhealthy food. And last but not least, governments, of course, can take the lead in providing a safe and healthy working environment. For example, by enforcing stronger occupational safety standards. Now, in addition to these four cross-cutting policy domains, governments should also try to take a lifespan approach to wellness, because wellness really begins in infancy, at very young age. Wellness is a lifelong pursuit. It's a lifelong activity, right? So a good example of a government's lifespan or lifelong approach to wellness, to promoting wellness, is Japan's 100-year life policies. So these four cross-cutting policy domains, in conjunction with this lifespan or a lifetime approach, can help Asians navigate the uncertain and stressful COVID-19 world to a better, more stable post-COVID new normal. Next slide, please. So what are the key takeaways from the Asian Development Outlook Update 2020? One is that COVID-19 highlights the importance of both physical health and mental health. Second key takeaway, wellness is a large, and not only large, but fast-growing component of the Asian economy. Third, Asia has a rich wellness traditions to draw upon. Traditional Chinese medicine and India's Ayurveda, and also many other local national wellness traditions. Fourth, there's a lot of scope for policymakers, for governments to promote wellness for all Asians, including poor Asians, by building wellness infrastructures in low-income neighborhoods, for example, public parks, sports facilities, basketball courts in low-income neighborhoods, and so forth. And last but not least, a sound mind and sound body is vital for Asia's recovery from this unprecedented COVID-19 crisis, which means in the end, wellness is vital for Asia's economic and social recovery. So now, before I pass it on to my colleague, Matthias, who will be moderating the panel, let me just say that the three panelists were really the core contributors to this ADO update theme chapter, wellness in worrying times. And Matthias, the moderator, was also a significant contributor. So the floor is yours, Matthias. Thank you.
Thank you very much, Dong-Yang, for this excellent presentation, which nicely prepares the ground for our discussion now. It's a real pleasure to moderate this panel discussion. Today, we're honored to have with us three of the leading experts on wellness worldwide. And let me briefly introduce you our very distinguished panelists. First, we have Ms. Ophelia Young. She's a senior research fellow at the Global Wellness Institute. Second, we have Ms. Catherine Johnston. She's also a senior research fellow at the Global Wellness Institute. And third, Professor Gary Bodecker from the University of Oxford. As Dong-Yang has mentioned, they have significantly contributed to the theme chapter and also helped us a lot to shape our ideas around this fascinating topic of wellness. So to start the discussion, let me first ask a question to Ophelia, and it's related to the topic of wellness and development, because often we hear that a lot of people think when they hear wellness about the rich that basically go, as Dong-Yang mentioned, to yoga. But can you tell us a bit more why you think wellness is so important for development? Why is it a key pillar actually of development? Ophelia, over to you.
Yes. So yeah, like Dong-Yang said, there is often a misconception and people think of wellness is for rich people in rich countries. Going to a nice yoga retreats or drink their very exotic, $10 green juice. Or some fancy exercise class in some fancy studio. But as Dong-Hun actually mentioned, what is the definition of wellness? It is an active pursuit of lifestyle and activities that lead to holistic health. So we're talking about a lifestyle here, and a lifestyle that keep us healthy. So it's about preventing disease. And why is it so important for people who are not rich? Why is it relevant to everyone in a developing country context? It's because, we know from epigenetics research now that our genes only determine 15% of our health outcomes. 85% of our health outcomes is determined by our lifestyles and our environment. So, and as people in countries who get wealthier, there is a trend of people, as they get less or suffer less from infectious disease, they're suffering more and have higher mortality rates from chronic disease. And we're talking about heart disease and diabetes, hypertension, obesity, lung disease. And a lot of these are preventable. And and in a lot of developing countries, what we're seeing is people are moving away from their traditional lifestyle as countries urbanize and they become, the work becomes more sedentary and their diets change and their stress rises. So you see people, get more chronic disease and within countries, the people who are at a lower income category tend to be at a higher risk of chronic disease because they will have less access to healthy food and to exercise. So when you're looking at a country, in a developing country, not necessarily very high or middle to middle high income, some of them, you're going to looking at a trajectory of really rising healthcare costs. So Duncan talked about, wellness as important as an economic contributor, as an industry. But when you look at the sort of mitigation of healthcare, rising healthcare costs, it is like a really super important for developing countries as they're getting, wealthier and as people get richer, because you don't really want them to, before the country get rich, you're already being impoverished by rising healthcare costs.
Thank you very much, Ophelia. Maybe let me turn to Catherine and ask a bit about COVID-19, because we're living through the worst public health crisis in almost now a century. And I think the topic of wellness is really highly important at this point. Catherine, maybe you can tell us a bit more how we can look into wellness as an important instrument to cope with the pandemic, and also looking post-COVID-19, will actually wellness become an important element of daily life? Will actually be this COVID-19 pandemic be a wake-up call to the world to place higher priority on wellness? Over to you, Catherine.
Sure, thanks. So as Dong-Hyun mentioned in his remarks at the beginning, I mean, COVID-19 has just incredibly raised awareness among the general population and governments and everyone on how important public health systems are, that we need strong systems in public health, and how important prevention is, both in terms of the environments we live in and people's behaviors. And we can see that with the pandemic itself, that what's driving, the spread and the rates and, the different levels of challenges that different countries and different regions are having depends upon the way their public health structure is dealing with the pandemic. And it depends upon community norms and individual behaviors and people's, willingness to change behavior in order to fight this off. And so that's something that I don't think there was not much attention on that in the general public or even, generally in governments before this pandemic hit. And along with the fact that we have the infectious disease crisis now, I think Dong-Hyun also mentioned that it is directly linked to a bigger and longer term crisis that we have with chronic disease and the risk factors that are associated. And the interesting thing is that if we go back 100 years, the biggest causes of disease and death were infectious disease. 100 years ago, you had cholera, you had tuberculosis, yellow fever. That was what killed people. And the way that society and countries, especially the United States and Europe and developed countries, fought that off was not through medicine and not through the healthcare systems, but through changes in infrastructure and the built environment. So we saw, a big push in public health in terms of sanitation structures and delivering clean water to people's homes and fresh air in people's homes and change in the way tenements and houses were built. And that's what drove off those diseases. So we fought off infectious disease, and now we're at this point where generally that's not the biggest concern we have in terms of widespread death and public health in the middle to upper income countries. But of course, infectious disease is not gone. We see that now with COVID. But what's happened is, we can hope that with the new attention that has been drawn to these issues, both, individual behavior and the environmental factors that affect COVID, that, that will hopefully raise a push of having better public health systems that can focus on these other disease epidemics, the chronic disease epidemics moving forward. And then one other thing, the interesting thing that's happened during the pandemic is just putting an incredible spotlight on other health and wellness challenges that we have, one being mental health and mental wellness, and also loneliness and social isolation. And of course, those have all been exacerbated by the crisis. They're being talked about in the media. People are more aware of what's happening, the lack of resources for addressing mental health challenges that are now becoming worse under COVID, the challenges people face with the lockdowns and with the quarantine regulations, being stuck in their home and being isolated. I mean, those are front and center now, and people are talking about them. And so, again, we can hope that spotlight then moving forward becomes something that we can start to address more proactively.
Thank you very much, Catherine. Talking about mental health, I would like to turn to Gary. You have done some research on the resilience in terms of mental wellness. Maybe you can share some insights with us on this topic of mental wellness, because it's very important, as we just heard in the context of the COVID-19 pandemic.
Gary, thank you, Matthias. Yes, the thing we need to understand is that, for a start, mental health is one of the biggest areas of concern to the World Health Organization. And depression, prior to COVID, was listed as the leading cause of disability in the world, including in Asia. We also know that the mental health budget in health budgets of the region and in the world is generally the smallest component of health sector budgets. And in Asia, we see that 80% of the mental health budget is spent on mental hospitals. So when we see widespread mental health crises like this situation in COVID, which has multiple dimensions to it, we have to accept that the mental health system and mental health practitioners are never going to be able to deal with this. That this really is something that comes back to the community to understand, and back to the individual to know about and act on. And in our work, both for the white paper on mental wellness that my colleagues and I in the Mental Wellness Initiative of the Global Wellness Institute published, and in a recent chapter we've published in the Oxford Research Encyclopedia of Global Public Health, we make the point that there's so much evidence that pathways to mental health and beyond mental health, to flourishing, to thriving, to resilience, are low cost or free. There's a lot of evidence supporting that these work. They can be done individually, they can be done in small groups or large groups. And these are really the anchors for future mental health and wellness policy for the governments of Asia. As Dr. Park has pointed out, Asia has a wealth of traditions, both of the mega traditions of Chinese medicine and Ayurveda, which have influenced East Asia and Southeast Asia considerably, but in all the local traditions. And it's not a matter of introducing anything new. It's a matter of people recognizing the efficacy of their ancestral health, medical, nutritional, wellness, movement, meditation, stress reduction traditions, and activating those. And one of the things that's really important, again, I'd like to reiterate what Dong Yun mentioned, is that this has to be, from a policy point of view, a lifespan approach. There has to be a commitment, because of what we know about the first 1,000 days of life, from conception through to the early years of life, from the epigenetic impact of lifestyle influences on future generations, that starting from conception or even preconception through infancy, childhood, adolescence, adulthood, older age, a wellness framework has to be tailored and nuanced educationally, programmatically, investment-wise, to the different stages of the lifespan for national transformation to take place.
Thank you very much. That brings me to the question of policies, because of course that's very important, and how to best improve the wellness of people. Maybe back to you, Catherine. How can we actually define wellness policy? And having that definition in mind, maybe you can talk a bit about wellness policies when it comes to healthy eating and built environment, as already Dang Yang alluded to in his presentation. Thank you.
Sure. So the interesting thing with wellness and with wellness policy is that if you look back at sort of the history, the last few decades of how wellness has evolved in, people's awareness and in society, is that for several decades, it's very much been a consumer-driven and a private sector-driven movement that's kind of happened in parallel to whatever's happening in the government policy and in health systems and trying to address medical issues. So it's only really been recently that governments have started to look at this at all. That may be one of the reasons that misperception that was talked about earlier exists. The idea that, well, wellness is something that a bunch of wealthy people do, but is it really relevant to government, to poor people, to developing countries? Absolutely, yes, it is. And it's actually pretty significant that ADB has even chosen to spotlight this issue, because as far as we know, it's the first time that wellness has been looked at from a policy perspective at this high of a level. And so it's exciting that we have the opportunity to talk about it within this context. And so what is wellness policy for governments? Well, you can look at different levels of policy because there are many different types of policies that are going to affect our health, our wellness, and our behaviors and our lifestyles. I mean, at the very top macro level, I would say there's kind of three levels. So let's start from the top. You have all the macro level things that are happening in the economy and in society, things like wars and conflicts, poverty, unemployment, inequity, pandemics like COVID. Those have a massive influence on our health and on our wellness. And so in one sense, you could say that government policy at all of those levels affects us in terms of our health and our well-being and our wellness. But we don't want to say that that's wellness policy because it's too broad, even though we all recognize how important it is. And so the way we look from the Global Wellness Institute and through our research, we look at wellness policy is at a middle and a micro level. So at the middle level of policy, what we're talking about is our immediate environments that we live our daily lives in. So that would be our communities, our homes and neighborhoods. It would be our workplaces, our schools. Those are our environments, and research from the social determinants of health tells us that those are incredibly influential in our behaviors and in our health outcomes and in our lifespans. And so government policy plays a huge role at that level in shaping those environments. So for example, Matthias, you mentioned healthy eating. Healthy eating, it's so important for us to have access in our communities to the foods that we need to eat, or we're not going to be able to eat healthy. I mean, people talk about, in some developed countries, people talk about the issue of food deserts. I think that's an issue that's becoming more widespread worldwide, that not everyone, especially in large metropolitan areas, actually has a place that they can easily access to buy fresh produce. Or perhaps in their neighborhood, the store down the street, all it sells is packaged and convenience food. That shapes the choices that we make because it shapes what we have easy access to. And so that's why policies that governments can create to shape, how we build stores, how we zone our neighborhoods, all of those things affect health. And so that's kind of the middle level of wellness policy. When we go to the micro level, what we're talking about is what do we as individuals choose to do? We make decisions about how we behave. We make decisions about what we eat. Do we exercise? Do we get enough sleep? And government policy can also play a role there because it can give us access to things to make those behaviors easy. So let's take physical activity. If you're wealthy, you can buy access to those things. You can go to a gym, fancy fitness center. You have all kinds of things you can do. But for middle and lower income populations, the extent to which the government can invest in providing recreational infrastructure, parks, playgrounds, sports infrastructure, all of those things in a community, in a neighborhood that are close to people, that are accessible, that are free, that are low cost, those influence, again, choices we make, that we can go do that activity because it's right there, it's down the street. Or, even Are we going to walk to the store rather than driving because we have a nice sidewalk, we have crosswalks, the infrastructure that's been built in our neighborhood is conducive to going on our door and doing active transportation, movement that makes us exercise while we're propelling ourselves somewhere rather than just sitting in our car and being sedentary. So again, the wellness policy, the environmental factors, creating environments that are encouraging of healthy behavior, and then the individual factors of, allowing us to have access to things that we need in order to do the things that we should be doing. Those are the two levels where we really see a huge potential and huge role for governments to play. Local governments, state, national, international, can all have a hand in this.
Okay, great. And when it comes to the workplace, what are there some possible policies? Ophelia, maybe you want to answer that question.
So when it comes to the workplace, there are a number of levels. First, we think about, there is a built environment issue, a lot, and then workplace safety. And so there are a lot of people who work in an environment where they're subject to a lot of unhealthy chemicals or substances, or they're working in dangerous environments, and there are all kinds of accidents that cause injury. So number one is really do not do anything like prevent harm to employees on a physical level. And so we know there is, from the agriculture, manufacturing, but then now when you're looking at some other industries like healthcare or office workers, carpal tunnel or repetitive motion injury. So that's like sort of like the most basic level in terms of prevention. And then when you look at more like the white collar workers and many other workers, I mean, stress level, of course, is, a huge problem. And then we think of the more like high-tech workers, the people in the more knowledge industry. Most people talk about, stress and lack of work-life balance. So a lot of these, when it gets to that level, it's a little bit harder for policy to address when you talk about maybe a workplace where, a certain culture, it's aggressive. So at the basic level, I mean, it's hard to legislate and make people nice to each other or treat the employees with kindness. So from a policy level, I think you can maybe just only make sure you lay down the kind of basic rules about harassment and hostile behavior, right? So that's sort of like different level at the, in terms of the workplace. And in countries like Japan, where being, overworked and dying from overwork is actually, there's a term. I believe there's a Korean and Chinese term for it, just dying from overwork. So I think Japan actually tried to institute some policy to limit the number of overtime hours. Don't know if that's working that much, but I've heard from some Japanese colleagues that slow change is taking place. But that the workplace is a pretty tricky area.
Yeah, I can imagine, but that's good news. Yeah.
Matthias, could I add a quick point to that? Mental wellness in the workplace is also extremely important, and that relates to people's sense of being heard, having some meaningful input to the management and production goal-setting process, fairness in the treatment of employees. And I think that workplace wellness is on the nutritional front being taken a lot further in some companies where where canteens are in fact nutritional and wellness food centers with healthy cuisine. And we know from the International Society for Nutritional Psychiatry that a whole food diet, and they spell out the details, which we've mentioned in our white paper, goes a long way to reducing mental health and stress problems. And so healthy nutrition offered in the workplace can be of great importance as well.
Can I add to that as well? I mean, I think not everyone's aware that when we're talking about wellness in the workplace, I mean, this isn't something fluffy like we're saying, well, let's just all treat our employees nice and be happy and be friends and have a great workplace. I mean, it is a serious economic issue, and it has to do with productivity. It has to do with performance of companies. There are massive GDP losses and productivity losses that come from sick, disgruntled, disengaged employees, absenteeism from work. I mean, these hit the bottom lines of companies and they hit the bottom line of economies countrywide. And so, addressing these things at every level that we can is, it's critical and it's essential to everyone in terms of people having jobs and employment and productive economies. And so it's something, it's not always understood as being part of wellness, but it may be one of the most critical things that we need to be thinking about.
Mm-hmm.
So
we return to physical activity, right? We're going to talk about physical activity. Is it?
Yeah, I mean, Catherine also already talked a little bit about it, but please feel free to add.
Oh, so I was just saying there is a question because we're talking about Duncan also mentioned the sort of infrastructure in cities, for ball courts and stuff. So it's interesting when we looked at the spending on physical activities in the big metropolitan areas, people, the middle class, the professional class of people, they're finding more and more options to go to different kinds of gym or exercise class. But in most countries, once you leave the metropolitan areas or you go to the smaller cities, there's much less facilities for people to do exercise. And in many Asian countries, the investment in sports had been focused on training elite athletes to compete in international or regional competition. It's more for a national prestige. And many countries do not have a sports for all policy to get the entire population to be physical active. So that is really something to do on a national level. And for young people, a lot of this could be done through, PE class and physical education at schools. But we know that for youth, once they approach a certain age, in certain countries, very often the girls become less and less physically active in the teenage years. And then, it goes on to when they're adults. And there are certain countries where, maybe girls are discouraged from doing team sports or exercising in public. And maybe there's some, there's already a culture of not encouraging girls, and some families may even not let girls do that. So the government can definitely have a lot of influence in that area through education policy. And also in certain countries, invest in female specific recreational facilities like women's gym, or having certain parks or facilities to have women's hours, girls' hours. And so those would be the areas of investment targeting certain that kind of population.
Great, yeah, thanks so much. We have a lot of questions coming in, so I would like to take the remaining time to go through some of these questions. And I will start with the first one by our colleague Abdul. He's asking, how close are we to being able to incorporate measures of wellness in our metrics for national progress development, as opposed to relying solely on pure economic measures such as GDP? What are the barriers to making this happen? I think that's a very important question. Who would like to take that? Ophelia and Catherine, or maybe Dangyang?
I can start. And I can say that very few countries are doing it. We're doing very, very poorly. Most of these metrics have been collected from physical activity levels to information on food. A lot of this have been collected by government agencies, but it's very siloed. They're not, they might be considered social indicators, health indicators, education indicators. They're not put in a framework that it's a most important investment for countries, especially at the budgeting level. So as far as we know, 2 countries have made made this official to have their well-being at the center of the budgeting. And New Zealand is one. And Wales, that's part of UK, but the country of Wales also had incorporated this, and they're called I think it's like future generation budgeting. So specifically incorporating these kind of metrics. And I think the United Arab Emirates, it's making some effort, but really most countries are still, you know, just looking at their economic investment and looking at economic outcomes. You know, employment, maybe employment, equity, and employment, but not really looking broadly. And I should also mention, in parallel to wellness, there's a whole happiness and well-being measurement that's been, you know, getting pretty well known by now. There's like a global happiness, world happiness index, right? It's been 10 or 12 years now. So there is a parallel policy research effort going on that front, on a well-being policy. And there are some overlapping areas with wellness, but not complete overlap.
Okay, thank you. Angyangi?
Yeah, if I may add to what Ophelia just said, as a matter of fact, here at ADB, right, as part of this ADO update theme chapter, as a matter of fact, my colleague Irfan Qureshi and an external consultant, his external collaborator, they put together a nice wellness index that was comparable across countries. It's a really new original kind of research. So they basically construct an internationally comparable, in other words, it can be compared across countries, index of wellness that captures the non-GDP or non-material well-being of a country's citizens, and they construct this index using publicly available data for 5 pillars of wellness, which are closely aligned with the Global Wellness Institute's definition of wellness. So for physical, the 5 pillars are physical, intellectual, social, environmental, and occupational. So they gather publicly available data. For example, for physical, life expectancy at birth, right? That's readily publicly available data. And for social pillar, they gather data on gender balance in school enrollment. So their main findings are that developing Asia performs similarly to the rest of the world in terms of this wellness score, according to the wellness index that they built. But there is, of course, significant variations across different subregions of Asia and different countries within subregions. And also, they find that the higher GDP is generally correlated with a higher wellness, again, according to their index. However, the correlation is not perfect. For example, some countries, because they're rich countries, you expect to perform highly in terms of wellness. Japan scores highly, Korea scores highly, Singapore scores highly, no surprise there. But at the same time, countries like Nepal, Bhutan, and Georgia, which are lower middle income countries, they also score highly. So there's clearly scope for government policies to influence wellness. And speaking of that, the index also helps to identify specific areas where governments can do more to promote wellness at the country level. So specific areas, for example, intellectual or environmental or social, and different specific areas within these pillars. Yeah, thanks.
Okay, thank you very much. That's an important issue that we need to follow up with. We have now 2 questions that look at specific groups. One is about the youth and the other one is about the elderly. So let me maybe start with the youth. It was the first question raised. How can we promote physical activity and healthy diets specifically for young people amid COVID-19? Can you share any best practices of interventions specifically for the youth? Who would like to take that one? Catherine, maybe?
Yes, could I come in here?
Oh, so for Gary, please.
Sure. I'll follow up, Jerry, after you.
Oh, sorry. Yes, I just wanted to mention that in our white paper on mental wellness, we did include a section. I'm just putting in here in our chat box, and perhaps Matthias or Joe, you could share that with the group. We did put in a whole section on incentivizing wellness. And there are many programs in the world now, including at the youth level, of incentivizing wellness. And they include people earning points through participating in wellness programs that entitle them to privileges or outings or prizes or whatever. And there's a whole framework for that. And I think if you just reference that section of the white paper on mental wellness, you'll see some of those there. Catherine, did you want to add to that?
Sure, I can follow up. I mean, I think in terms of, this question is specifically referenced, how can we do this in a COVID environment? I mean, I would say it's a different question for physical activity versus healthy diets. So just in terms of physical activity, I would say there's a low-tech solution and there's a high-tech solution. Phil here already touched on a lot of the low-tech solutions in terms of youth and, sports for all programs for children, access to facilities, education in schools, physical education. I mean, those things are essential across the board in terms of promoting awareness among young people and giving them access to physical activity opportunities. But the interesting thing that we've seen happening in COVID, the high-tech solution, is that there's been this just huge shift that was already happening, but it was accelerated of, an uptick of people looking for and using tech-based solutions for exercise and for physical activity. I mean, those things were already there. I mean, there's a huge app market in China alone for, all kinds of, apps that allow you to do yoga or, give you, meditations, all kinds of exercise programs. A lot of these are free. I mean, that because of the shutdowns and because of the business shutdowns under COVID and fitness centers and all those facilities being closed, those technology businesses have just gone like this. And it's really been an opportunity to accelerate that market because it does expand access, and it's something that's very accessible to youth. I mean, they have those phones on them all the time. They use these programs already. It's very accessible. It's very inexpensive. And so I think that's going to be interesting to see what happens after the pandemic in terms of that trajectory and whether that continues. On the food question, I mean, that's really a whole separate set of policies. I mean, honestly, I don't know if anyone's addressed that in a COVID specific way other than the fact that we know that food is an issue right now because in terms of hunger, I mean, that's a whole level of, challenge that's, even just beyond talking about wellness. But for youth, again, a lot of that's going to come back to education, education, and then the types of incentives that Jerry talked about. Food labeling, how we're marketing and advertising different types of foods to children. There are a lot of places that are looking at regulating that and restricting what children should see and how that shapes their decisions. And that's everything from television to online to billboards to what's available around schools. And so all of those efforts have been shown to be very effective to just build awareness among youth and change the choices that they make.
Can I just add to that? Coming back to the point about Asia's own wellness traditions, there's a growing body of research on the question of food, on the nutritional value of traditional Asian foods, fermented foods, Asian medicinal plants used in foods, and also specifically with respect to rice. There's a lot of research showing that Asia's use of white rice is really predisposing countries to spikes in diabetes. Polishing rice takes off the outer layer, the endosperm and the protein, and the endosperm contains nutrients that will promote wellness, brain development, and prevent non-communicable diseases such as diabetes and obesity. So I think education for young people around the science of traditional nutrition is also important.
Thank you very much, Gary. And I think you're also the best candidate for the next question because you've done a lot of work on aging. So the next question is, what does aging in Asia mean for health and wellness? And what does it imply for government policy? So back to you, Gary.
Yes, of course. And we've seen that Japan has introduced this policy of living the 100-year life. It's not coping with aging, it's living the 100-year life. So I think that Asia is beginning to understand that there is an aging demographic time bomb. As people are living longer, as they are in every Asian country and in every country around the world, there's the question of how is the economy going to manage this sector? Well, one of the views is that retirement age needs to be changed up to between 70 and 75. Not compulsory, but so that people are legally perfectly able to stay productive in the workforce as long as they are physically and mentally able. Another is the recognition that in retirement, in the old-fashioned sense of stopping working and stopping doing anything productive, is a death sentence. And again, referring to Japan, there's this concept of ikigai, Japanese word ikigai, which means purpose in life. And so having a purpose in life, be it through work, be it through family, be it through community contribution, is also extremely important as a factor in aging. Another is aging in place. That's gaining ground. For people to age in place, in other words, not to go into retirement homes and communities, there needs to be a whole investment and understanding around an investment in what it needs to be able to enable people to age in place. What are the physical requirements of a home, of a bathroom, of steps, of ramps, and so on? What are the service requirements of service in cases of emergency or semi-emergency being available? There's a whole ecosystem around that, and we've addressed those in our background paper for the ADO report. And then there's nutrition. Often when people are living by themselves, they eat less, they go to the stores less, and their nutritional levels go down. That is associated with an increase in dementia. Nutrition and dementia are linked. So policies around nutrition for the elderly. We have addressed all of these points in the background paper, and I'd encourage anyone who's interested to access that background paper on aging at the ADO website around this topic of wellness.
Thank you very much, Gary. We have a question also about public versus private expenditures, and the person is asking basically whether governments are spending enough for wellness, and I guess we already know the answer. Ophelia or Catherine, you want to come in?
I don't. I mean, I think this is actually the data that was generated by other team members, right? The chart that you're referring to.
Well, my interpretation, I mean, I'll just jump in terms of how I interpret that question is, are governments spending enough on wellness? Definitely not. You know, we're spending a lot on health and medical expenses, and those are going up exponentially. They're not, you know, we're taking care of the sick and the injured. We're not preventing those problems. And so what really needs to happen is a shift in spending in terms of what the government's prioritizing from, you know, just dumping so much money into, you know, sick care and looking more upstream at all the factors we've been talking about for the last hour in terms of how can we invest in better built environments, better facilities, and all of these things that people need in order to prevent the sickness to begin with. You know, there's obviously a lot of private expenditure in this space too. That's been around for a long time. That's helpful too. It's not a problem that governments are going to solve by themselves. It really does require very concerted action by everyone and partnerships to make these kinds of things happen. So, you know, we're spending a lot. We're not spending in the right places, I think is the what I would say.
I think I'll add that when government spends more, then the private sector can spend less. Like, for example, if there's a lot of free recreational facilities, outdoor gyms or classes and community centers, or, you know, swimming pools are free for people, or they dance on the street, dance class outdoors, and people don't have to pay for private classes. So this is a case where the private market can develop very quickly to meet a need, and but people who don't have money will not be able to access those things. So like Catherine said, everyone can spend more money on the preventive side, and and it will have a better return on investment than probably our sick care system.
And interestingly, those things don't require a big expenditure. I mean, one of the things we looked at in a study we did last year in physical activity is in some of the countries that, middle income, lower income countries, especially in Latin America, where the governments do not have the budgets to invest in, building a big sports facility for the neighborhood or building community centers and community gyms. They have a huge amount of programs, and they're so low cost. I mean, they're just using public plazas, and they're running Zumba classes in their public plaza 3 times a week, and people can go to them for free. They're doing open streets programs where every Sunday you close the streets off and people can run and bike and walk, and families come out. I mean, these are wildly successful programs. They don't require specialized facilities, and you can touch a huge share of the population this way without a big investment.
Great. So we're already almost finished with the time. So let me maybe ask all panelists to give us their last thought, and each of you, if possible, takes 30 seconds to 1 minute, just some last remarks from you, and then I will close the webinar. Thank you very much. So let's start with Ophelia.
Okay, so I think the most important takeaway is that wellness is about a lifestyle. And then from the policy perspective, it is really helping people to invest in a healthier lifestyle so that they can, do healthy things and choose healthy things. And the return on investment is very, very high in many aspects in terms of, productivity, like the fewer sick days and a much lower healthcare cost. And so this message really needs to be publicized much more.
Gary, over to you.
Yes. Following on from Ophelia's points, I would say that Asia has a rich heritage that it can draw on. It doesn't have to borrow anything from anyone. It can promote its traditions with pride and with evidence to really enhance wellness and reduce healthcare costs. And I think a lifespan approach to this is really important, that it's not just for students or for older people, but it's nuanced for different stages of the human lifespan.
Thank you. Catherine?
And following on what Jerry said, I think if you look back at the ancient history of wellness and the roots of wellness, like has been said before, so much of it has come out of Asia and is now being, modernized and incorporated into people's, practices and into healthcare systems all around the world. So I think, jumping off of that, it's exciting that this conversation is also happening in Asia, and, this ADO chapter and this webinar, and, it's really an opportunity to start a conversation and to hopefully, bring the attention on this issue to more governments and to more people in policy circles at all levels. And so it's, it's great that ADB has chosen to focus on this, and, let's keep this going. And, it's so important for everyone and for the future of our world. And at no time has that been more clear than it is now with the current pandemic and all the challenges the world's facing.
Thank you so much, Catherine. It was a very nice statement at the end. So it's now 10:30. This is the end of our webinar. Thank you so much to all the panelists and the presenter. I think it was a very insightful discussion that we had this morning. And please, of course, if you want to know more, read our ADOU theme chapter and also the background papers. They are available for free. And before closing, let me announce the next Asian Impact webinar. It will take place in about 2 weeks' time on November 26th at 10:30 Manila time. The topic will be the future of regional cooperation in Asia and the Pacific, and it will be hosted by our ADB Vice President for Knowledge Management and Sustainable Development, Mr. Babang Susantono. Thank you so much for listening this morning, and have a good day. Stay safe, be well. Bye-bye.